Hello, my name is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and I'm here to answer some of the questions regarding underbite. One question that I do get asked is, what is underbite and how does it affect my facial structure? So let's answer that. So underbite is essentially, ideally we want to see your top jaw, top teeth overlapping like this, your bottom teeth. But with underbite, it's actually reverse. So your bottom jaw is placed more forward and your top jaw is a little bit behind. Your top teeth are behind. It actually could be your jaw or it could be your teeth. But this is actually how it will look like when someone has an underbite. And how does it affect your facial structure is you will see as your teeth or your jaw is more, the bottom jaw is more aligned forward. So you will have a bit of a protrusion of your bottom jaw, or we can even see in some cases that more protrusion of your chin. So that's essentially how it looks like, and how the facial structure would look like when somebody has an underbite. Obviously, the extent can vary from patient to patient. Another question I do get asked is, what is the difference between underbite and an overbite, and also how each of them are corrected? So here we can answer that. So the difference between, or comparison between underbite, as we talked about before, the underbite is where your bottom jaw is more facial forward placed. It could be your jaw or it could be your teeth. And then on the overbite is actually the reverse. So you have a more space on your upper teeth, or your upper jaw is more forward. So that is the difference. Underbite like this, overbite like this. And then how each of them are treated, depending on the severity of each case, sometimes we are able to treat that with using either Invisalign or traditional braces, or in some cases it might require surgical intervention as well too, where your jaw has to be surgically corrected, whether it's the top or the bottom. So those are some of the treatment options for correcting overbite and underbite. Another question I do get asked is, what causes underbite and can it get worse if not treated? So let's answer those questions. So what is underbite is essentially your lower jaw has grown more forward, or also that your upper jaw has not kept up with the growth according to your bottom jaw. So it could be just your tooth positioning too. Sometimes it's just the jaws are aligned well, but it's your teeth are positioned too far out, which kind of creates like an underbite. Or it could actually be your jaw growth, upper jaw growth not matching with the lower one, or your lower jaw had an overgrowth compared to what the upper one had. So those are some of the causes for the underbite. And like anything else, like if it's not treated, it can get worse too. So you want to make sure as soon as it's diagnosed, you act on it, whether it's a surgical treatment that is required, or it could be orthodontically by traditional braces. There are different appliances can be used. Actually, earlier we can spot it, earlier it's diagnosed. The early intervention can correct actually underbite much easier as compared to going into adulthood. So as soon as it gets diagnosed, I would recommend that going into a corrective actions, whether it's a surgical treatment that is required or traditional braces. There are different kind of appliances that can be used to enhance the upper jaw growth, or trying to keep the lower jaw from actually accelerating the growth forward or moving the teeth behind. So get into a corrective action as soon as the underbite is diagnosed is the best way to not letting it get worse and having more impacts on your overall bite, and look of your face as well too. Another question I do get asked is, can Invisalign fix underbite or braces are a better option? So answer to that is, it depends on the case. So either whether you're seeing an orthodontist or it's your general dentist, is treating your case, they will evaluate what is the severity of the underbite. And based on that, Invisalign, yes, can correct up to a certain amount of underbites. Invisalign can correct. So it depends on the severity of the bite. Based on that, Invisalign can correct it, traditional braces can correct it, or you might need a combination of two, or you might even need some surgical approach as well too. So it depends on the case, what is the severity of the case, and what is the best way to treat that. Another question I do get asked is, are there natural ways to correct underbite? So unfortunately, there are not any natural ways to correct the underbite, because either your jaw has grown already far forward, so there's no natural way to bring it back, or if your teeth are aligned like that, which is creating the underbite, there's no natural way that we can bring it back. So the treatment options would be whether it's Invisalign that can fix it, or it's braces, or it's a combination, or other orthodontic appliances that are available, or it's a surgical treatment that will fix that. So it's always with some kind of a treatment that you can fix that underbite. Another question I do get asked is how long will it take to fix underbite by orthodontic treatment? So it's an average of time, because every case based on the severity will vary. So on an average underbite cases, when we are just treating with Invisalign or combination of Invisalign and braces, or braces, it can go anywhere from 1 year to 3 years of time. I hope I was able to answer most of your questions regarding underbite and various treatments for underbite. If you have any other questions, please feel free to call us. Our number is 603-926-8827. You can also visit our website, which is www.smilesbythecnh.com, and we are happy to answer your questions and help you with your treatment.